But I would like to introduce you to Angelia. She's on. Let me make sure. Oh, there she is. Hi, Angelia. You should be able to share your screen, but she is with GSK and SM Lupus. She's going to talk to us today about Lupus 101. So let's enter. Well, thank you, Dr. Eve, and welcome, Angelia.
Okay, give me 1 second. I'm trying to pull up my screen and let me get this situated. There we go. Well, thank you for having me, and thank you everyone for joining today. I'm really excited. Can you hear me okay? Give me some thumbs up if you can. Okay, awesome. So I am so excited to share this new education that we've been working really hard on developing for lupus patients. And so we're going to go back to a little bit of the lupus basics, as well as we're going to talk a little bit about lupus nephritis. And some of you may already be experts if you are a lupus patient. I'm a lupus patient. I'm far from being an expert, even though I am a nurse. But I have learned a lot through working with Andrea on doing these educations and hearing from patients. And I'm just excited to share this. So I'm going to go ahead and get started. This is just a little bit about my background. I am a nurse, and I've been a nurse for over 20 years. I have my master's in nursing, and I am actually finishing up my doctorate in nursing. So nursing is a field that I really enjoy because it really takes care of a lot of patients, and I hope I can help. And I'm hoping with this education today, it's going to be really helpful for you. And I also know that Adrian provides a link to this video after the presentation. So you'll have it to look back on, and you'll also have it to share with your family members, because a lot of times I know it's hard to explain lupus and what you're experiencing with family members or loved ones. And this is a great way to help get them educated and get them involved. So again, thanks for having me, and let's get started. So we're going to talk about understanding lupus. We're going to talk a little bit about the immune system. I'm not going to get too crazy on the immune system. I'm going to keep it, pretty basic, just what you need to know. Signs and symptoms of lupus. We're going to touch on lupus nephritis, and then we'll just talk about some lifestyle management. So what is lupus? Sorry, I'm trying to move this video real quick. Lupus is an autoimmune disease, and what happens with lupus is the immune system starts to attack itself. It starts causing inflammation, and that inflammation settles into your organs and tissues, and that causes pain, and it causes damage as well. Lupus is a chronic illness, so once you're diagnosed with lupus, it doesn't go away, but lupus can be managed. So there's treatments for the signs and symptoms of lupus. And again, there is no cure, but working with your doctor and learning more about lupus, you can manage your lupus. Lupus is usually characterized by flares and remissions. So that means sometimes you may feel good and sometimes you may feel worse. And I think that's the confusing part, not only for a lupus patient sometimes, but it's really confusing for our loved ones and our spouses or children or whoever's in your life, because a lot of times they'll see you very healthy. And then the next time you may be like, I can't do this because I don't feel so well. I'm having a lupus flare. And so this is, I think, the really confusing part. And it's also really confusing for doctors sometimes too, because our symptoms come and go. And so it makes it really hard for doctors to really get a real good insight on how your lupus is impacting you. And we'll talk a little bit more about journaling your symptoms and writing your questions down before you get into your doctor's office, so that you can bring this information to your doctor and have a really good, productive conversation with them and give them a really good insights on how your lupus is doing and how well your lupus is managed. So who gets lupus? Well, lupus is anyone can get it. We have some ideas of why people get lupus, but there's about 1.5 million people in the US living with a form of lupus. And so the one that I'm really focusing on today is systemic lupus erythematosus. And that is also called SLE, or just lupus, and it affects from your head to toe. So you can have symptoms anywhere from head to toe, and we're going to talk a little bit more about those. And sometimes your symptoms are invisible and some of them are visible. Women of color between the ages of 15 and 44 are more likely to be diagnosed. And no one quite understands lupus, but again, we kind of understand that it could be a combination of things from hormones, genetics, or your environment. It's also important to note that 1 in 10 patients, lupus patients, are men. So, so if you have any men who in your family who have lupus, it would be great to share this information with them or invite them to come and join Adrienne and LFA on some of these educational events that we do, because we don't want to leave out anybody who is suffering from lupus. We want to help them, we want to educate them and help provide them some tools. So now I'm going to go and dig into the immune system a little bit. So the immune system fights off foreign invaders, which could be viruses, bacteria, or other germs. And what happens is your body, once it identifies the virus, bacteria, or germs, it starts making antibodies. And those antibodies is what protects you from these viruses and bacteria and germs that you come encounter with over and over. So, so that's how an immune system works. That's just the basics of an immune system. But the immune system and lupus, what goes on is, again, with lupus, your immune system is a little bit confused. There's inflammation going on, there's damage occurring. And so your body can't really tell the difference between healthy tissue, its own tissue, versus foreign invaders. So, so what happens, again, your immune system creates antibodies. They attack and destroy healthy tissue, causing the inflammation, which then that causes pain. And then it also causes damage and scarring in different body areas. Everyone's lupus is different, so you may or may not be impacted on all the organ systems that I'm going to talk about, but it's good to know that lupus can affect you, again, from head to toe, and that's why it's really important to write your symptoms down and share these symptoms with your physician. With the lupus symptoms, they can occur internally and externally, and that's why I'm going to talk a little bit more about this so that you're a little bit more aware of what lupus is affecting. So it can affect the brains, it can affect your mouth, it can affect your eyes, nose, your skin. I mean, we're very familiar with a lot of the skin conditions, like the rashes that may occur with lupus, or the rash across the face right here. It can inflame the heart, inflame the lungs, the kidneys, cause muscle pain. Inflammation is going on in all these areas, as well as joint pain, and it can affect your bones. And this isn't an all-inclusive list, but it is a good idea of the most common areas that lupus impacts patients. So what are some of the common signs and symptoms? So again, lupus can be invisible symptoms and visible. And the visible symptoms are the ones that are on the outside of your body. So you may notice, like, you might have hair loss when you're flaring. You might have joint pain and swelling, which is arthritis. You might have skin rashes, again, the butterfly rash that we talked about. And you might have mouth or nose sores. These are some of the visible symptoms that could occur with lupus patients. So I think it's really important that we recognize these symptoms and that we take note of these symptoms in between our doctor's appointments so that we can share them with our physicians so they can have a very clear understanding of how lupus is impacting you. So some of the visible signs of lupus that happen inside, invisible signs that happen inside your body, and that's organ damage. And we can't see organ damage unless we are aware of some of the symptoms that occur with organ damage. So inflammation in the kidneys may cause blood or protein in the urine. So it's really important, like, we necessarily couldn't see the blood unless it's very obvious, but that's why it's important to go to your doctors on your scheduled appointment so they can check your urine and look for the blood and look for the protein in your urine so that they can catch anything that might be happening so that it doesn't progress and get worse. There could be inflammation in the heart and lungs, and you may experience chest pain with that. That's when the lining of the heart gets inflamed or the lining of the lungs get inflamed, and you might feel some chest pain, you might feel some shortness of breath. Also fatigue. You might have abnormal tiredness throughout your entire body. You might feel like you can't do much effort because you're just really exhausted, really fatigued. So those are the kinds of symptoms you want to make note to your doctor so they better understand how lupus is impacting you, because when you're extremely tired, extremely fatigued, it's really hard to do our normal activities that we do each day. Also, 80 to 90% of people living with lupus experience some form of fatigue. So just think about that. So it's very common that a lot of us lupus patients, we experience fatigue. And for example, I can tell you when I'm in the sun in the summertime, that's when my lupus just starts flaring. And I have to stay very close with my doctor. I have to track my symptoms, and I have to monitor how much sun exposure I get so that I don't start losing my hair, I don't have the rashes, and I don't feel super fatigued. So everyone has different symptoms and experiences with lupus. So I really encourage you to figure out what it is that is most common with your lupus so you can have those conversations with your doctor. Also, there can be neurological effects, which include headache, depression, seizures, stroke, or neuropathy. These are really important symptoms to share with your doctor also. If you feel like you're having a headache, sometimes those headaches are low-grade headaches, or you can have really strong headaches. So, you know, it's really good to mention that to your doctor. And I really want to touch on, you know, if you ever feel depressed, because I know that sometimes you may feel isolated because, you know, you're too tired to continue doing social events. You know, you work really hard to get what you need to get done, but then you may not be involved in social events with your family or friends. And so if you ever feel like you're depressed, reach out to your doctor, because they're there to help you, and they have a lot of resources to help you or refer you on. Also, these are not all the possible symptoms of lupus, but I think it's really important just to mention these because they are some of the more common symptoms that occur on the inside of our body. And that's why it's really important to continue to communicate with our doctor, share our symptoms, and ask questions so that they can really stay on top of your flares and your lupus. So with the brain, what happens is 50 to 80% of people living with lupus may experience brain fog. So if you ever wondered, you know, how many people are experiencing brain fog with their lupus, it's a pretty high percentage. It's 50 to 80% of people living with lupus are struggling with some of the symptoms associated with the inflammation that's going on, such as, you know, you may have trouble remembering things. So your memory might not be as good when you're during having a flare, your concentration, paying attention. You might be easily confused. You may, you know, sometimes forget your words. So these are really important things to share with your doctor. If you feel like you're experiencing any of these symptoms, this is a really good indication that you may be having a flare. So again, I just encourage patients to write their symptoms down. And one thing that I always recommend is journal your symptoms, and you can do it in your phone or you can do it in a calendar, wherever you feel most comfortable. Just journal your symptoms down. And one easy way that I always recommend is if you get a calendar, and if you put a check mark on your good days and an X mark on your bad days, and then write what symptom you're struggling with. When you go to your doctor, you may have like 3 months worth of information on how much your symptoms were impacting you. And so that's a great way to share with your doctor so they can look back over the 3 months and see if you haven't been struggling with too many symptoms, or there's several symptoms that you might have been struggling with. It really gives your doctor a great insights in how it's impacting you, as well as it really opens up that communication with your doctor as well when you have something to share with them, because we always forget sometimes when we're in our doctor's office to bring up things that we want to talk about. And so it's really nice when you have this information in front of you. This, we have a lupus, an Us and Lupus Facebook page and Instagram page. So if you're not part of it, I encourage you to check it out and like the page so you too can be part of that community. But one of the lupus warriors wrote, "It is definitely an invisible disease. Through it all, we have to keep pushing." And so we like these comments that we see from patients because we like to share them with other lupus patients so that other lupus patients know that they're not alone. So again, that is our Us and Lupus page on Facebook and on Instagram. So I encourage you to go ahead and like those pages and be part of the community if you like. So in the chat box, I'm always curious about what kind of symptoms patients are experiencing. So if you want, go ahead and type in the chat box. What are some of the symptoms that you've experienced? And maybe what were those symptoms that really brought the doctor's attention to you maybe having lupus and then uncovering that you have lupus? I really like looking into it. I learned so much from that. And also when patients do that, I think other patients learn of some of the other symptoms that could be occurring. So you're not only helping me, you're helping everyone else with what type of symptoms you might have experienced and what led to your diagnosis. So now I'm going to move into talking about lupus nephritis. So what is lupus nephritis? Lupus nephritis is considered part of a kidney disease. So it is a kidney disease, and there's different classes. And this is where your doctor can really help you if you're struggling with any of the symptoms related to kidney disease or lupus nephritis. What happens is there's swelling and inflammation and irritation in your kidneys. And again, we may not know that unless we're aware of some of the signs and symptoms of what inflamed kidneys may look like and may be doing. So approximately 35% of newly diagnosed adult lupus patients can have clinical signs of kidney involvement. And about 40% of adults with lupus will develop lupus nephritis. And also up to 3/4 of children, so about 75% or 3 out of 4 children with SLE may develop kidney involvement. So who gets diagnosed with lupus nephritis? Among patients with SLE, lupus nephritis and lupus-related kidney disease are more common in African Americans, Asians, and Hispanics. Men are also more likely to develop lupus nephritis than women. So I think this is a really good slide to really educate us all on who may be at risk for developing lupus nephritis. And this is why it's really, really important to stay in contact with your doctor, have these conversations with your doctor, ask your doctor about lupus nephritis, ask your doctor what do your urine results tell him or her. So the role of your kidneys, what exactly do they do? So we probably all know this, but I'm just going to review it. They remove waste and extra fluid from the body. They help control your kidneys or your blood pressure. We all have 2 kidneys, and maybe some people may be down to 1, but it helps control your blood pressure. It creates new red blood cells. It keeps your bones healthy and strong. And it also helps to maintain the pH levels in your blood and clear out chemicals. So the pH is a measure of acidity and alkalinity. So we want to have a great balance with that. And that's what's going on with your kidneys. And your doctor can tell what's going on with your kidneys when they do the urine sample and when they also draw your blood. So it's very important to stay on top of our appointments. If we miss our appointments, try to get rescheduled for your appointment, because again, we may not see what's going on, and it's very important to have these tests done so that they can keep an eye on our organs and make sure everything is functioning okay. So what happens to the kidneys in lupus nephritis? So lupus inflammation can cause scarring in the kidneys, and that's what happens when your kidneys get impacted and can't function. So all the inflammation starts settling into the kidneys or that tissue or any of your organs, and then scarring starts occurring, and that is what causes your kidneys or other organs not to function properly. So some signs and symptoms of lupus nephritis, and I think these are great symptoms to take note of, is notice if you have any swelling in your feet, your ankles, your hands, your legs, or around your eyes, like around the eyes right here, if you have any swelling. Take note if you have high blood pressure. Take note if you notice any blood in your urine or like discoloration, dark discoloration in your urine. Take note if you see foamy or frothy urine or lots of bubbles in your urine. And also how often you need to go to the restroom, especially at night. These are important factors for the physician to know. These are not all the possible signs and symptoms of lupus nephritis, but they're very common signs and symptoms. And so I really encourage you to be familiar with them so you can help your doctor, because remember, you are the most important individual on the team taking care of your lupus. So just remember that you are the most important person in managing your lupus. So I spoke a little bit about the classes of lupus nephritis. And so you'll see there's class 1 through class 6, and the less severe forms are class 1 and 2, and the more severe forms become 3, 4, 5, and 6. And this is what your doctor is looking at when they're looking at your urine sample analysis, and then what they're looking in your blood to make sure that you don't reach the more severe classes of lupus nephritis. That you may have heard of it called stages also. It could be considered stage 1 through stage 6. These classes are based on kidney biopsies, and what happens is some patients may need to get a little sample of their kidney taken. That's a kidney biopsy, and then they look at it and they look to see how severe your lupus nephritis may be. So talk to your doctor about lupus nephritis, talk to them about the different classes and stages. Talk to them about, what your results mean. And I really encourage you to really have those conversations with the doctors. They're more than happy to talk to you about this. They're there to help you. And when you go into your doctor's appointment, just remember that appointment is about you and you alone. So you get your questions answered. You ask your most burning questions first, and then you get your symptoms, your symptom tracker or your journal out, and you share what symptoms you've been experiencing. And that way they have a really good idea what's going on. Otherwise, if we go into our appointment and we just answer the questions that they ask us, we may not share everything that's going on with us in the last 3 months or ever how often you see your doctor. So, so I really encourage you to advocate for yourself, and you drive those conversations so you can walk out of that appointment getting your questions answered and sharing the information that you needed to share with the doctor. So know the facts, take ownership of your lupus lifestyle. Untreated lupus nephritis can lead to scarring in the kidneys and more severe damage. And that's the thing we want to try to avoid. And so that's why we thought it was important to really share this information. About approximately 20% of patients with lupus nephritis will progress to dialysis treatment or kidney transplant within 10 years of diagnosis. And so this is just good information for awareness. You now have information on what some of the signs and symptoms are. I encourage you to track those signs and symptoms. And again, keep sharing it with your doctor. Keep opening those conversations up with your physician. Another lupus warrior who went to our Facebook and Instagram page posted, "I was diagnosed with lupus in 2015. I have SLE and stage 2 kidney disease. You know your body better than anyone, so pay attention to what triggers your flares and keep your appointments and educate yourself." And we thought this was a great posting where another lupus warrior shared this, because it really is very helpful to make sure you're keeping your appointments, continuing to educate yourself, come to these educations that LFA puts on, that Adrian has set up. Also, look for LFA National. There's tons of education that they put out as well. And also go to usandlupus.com. That is our GSK website, where we have a lot of information for you as well. And we also share symptoms, and we talk a little bit more about lupus nephritis on our website. So I encourage you to check out usandlupus.com. And if you stay tuned towards the end, I'll show you some QR codes where you can easily jump to those pages on our website. So in the chat box, have you discussed lupus nephritis with your doctor? So go ahead and put that in there. Have you ever mentioned that to them? Have you ever thought about it? I will tell you, for me, doing these presentations has really encouraged me to talk more about it as well. I know that I am stage 2 lupus nephritis. So I really want to make sure that I am having those conversations with my doctor. I'm doing what they're telling me to. I'm asking questions and I'm learning more about it, because I am not a kidney doctor. And so the only way that we can continue to learn is ask questions and continue to educate ourselves, because we want to protect our kidneys and our other organs as best as we can since we have lupus. So some of the lifestyle approaches to lupus management, I'm going to go over that. And maybe you want to share in the chat box also what you're doing to manage your lupus. What are some lifestyle things that you've had to adjust? Are there any changes that you've had to make since you have been diagnosed and living with lupus? And so again, everything you share not only helps me, but it also helps everyone else on the call. And we just continue to educate each other, because that's the only way we can help each other is to keep learning from each other. So what are some ways to manage lupus as part of your daily life? So you can monitor your symptoms. And if you go to usandlupus.com, you can also download a symptom tracker, which is a great tool that you can use. Also, you can download a doctor discussion guide. You can also download an impact tracker on how lupus is impacting your life. And these are great tools to bring into your doctor's appointment. And I always encourage patients, you know, sit down the night before your doctor's appointment, pull down these forms, you know, have them ready and available so that you can photocopy them and sit down the night before and check off what's been bothering you. And, you know, you don't have to think back if you haven't been tracking, you know, in between like the 3 months that leads up to your next appointment. You can sit down the night before and just think back 2 weeks, you know, 10 days. What has been bothering me? Have I been feeling really fatigued? Have I not been doing social activities? You know, have I not been going to my kids' sporting events? You know, whatever it is that's been going on, just check off what's been going on. You've been feeling more fatigue. You've been having mouth sores. Your hair's falling out more. You know, whatever, your joints have been aching a lot more. You know, whatever those symptoms may be, just check them off and carry that form into that doctor's office. And then you guys sit down and just have a discussion about what symptoms and then what questions you have. Also get the right nutrition, take time to self-reflect, communicate openly, get tests and treatments. Again, you know, make sure you're going to those doctor's appointments so that you can get your tests done each time you're in with your physician, your lab test, your analysis test, your blood test, you know, whatever test that your doctor does, you want to make sure that you're not missing those. And also you want to make sure that you're not stopping any of your medication or your regimens that your physician has recommended. If you find that there's a regimen they have you on that you can't adhere to, don't stop it. Just have that conversation with your doctor, call them and find out what works for you. So again, you are the most important person on this team of managing your lupus. So make sure you have those conversations. Talk to the specialist. If your rheumatologist refers you to another specialist, make sure you're carrying your journal, your symptom tracker, you know, your questions to these specialists so that you can get your questions answered, because it's all about you when you're with these doctors. So I really want you to own that and know that when you go into those appointments, because I know how intimidating it can be. Even though I'm a nurse and I've been a nurse for over 20 years, I sometimes get intimidated by the doctors. I get caught up in their questioning, and then I walk out and I forget to ask my questions or share my symptoms. So I've gotten much better about tracking my information and carrying it into my doctor's office and asking my questions and sharing what's going on with me. Lupus is a fingerprint disease. And what I mean by that, everybody's lupus is different. And so, so it really helps the doctor, since they're dealing with so many different lupus patients and how lupus is impacting everyone else differently. It's really important to bring what's going on with our lupus so that they can help us. And always stay informed, just like you're doing today and in future events. And also remember usandlupus.com, and also LFA website has a lot of information on lupus. So remember that every symptom matters. So you may not know at first which symptoms you feel are a result of lupus. And that's why I like sharing everyone's symptoms of what, how maybe you were diagnosed or what symptoms are your most triggers. So you know, just learn from everyone, because sometimes maybe I've seen people post where, you know, they didn't realize that was a symptom of lupus, you know, so it's really good how we can learn from each other and be aware of what some of these symptoms that are associated with lupus that we may not have experienced yet, but then we're starting to see. Be proactive. Any symptom of lupus is the result of inflammation in your body, and over time that inflammation can lead to organ damage. So continue to keep track, make notes of your symptoms, and figure out what works best for you. Like for me, I like calendars. That works really well for me. And I like checklists, but figure out what works best for you. Maybe a pretty health journal, you know, they have them. I know Adrienne showed me her health journal once before on one of these webinars. So, you know, you may have a health journal, or you may do it on your phone. You may use it in the notes section on your phone. Anything that works for you, that you find that's easy and that you can keep with you, go ahead and try it out. Try to start journaling and tracking your symptoms and writing those questions down when they come to you. And hopefully you'll find that helps you in your doctor's office appointments. Journaling for lupus nephritis. So whether you're concerned about your kidney function or have been diagnosed with lupus nephritis, monitoring your symptoms is always important. So, whoops, sorry about that. So keep note of how much water you're drinking. Track how often you urinate, how often you go to the restroom, track the color, track if it's foamy, track if it's dark color, track if there's lots of bubbles in your urine. Monitor your blood pressure, make notes of any changes in your blood pressure. Check for areas of unexplained swelling. So remember, we talked about swelling in your hands, your feet, your ankles, around your eyes. You know, check for swelling on those areas. Make note of that, and make note of any rapid weight changes, such as rapid increases in your weight. That can mean that you're retaining fluid and your kidneys are not emptying out all the fluid in your body. So just remember that. If you notice any changes in your symptoms, speak with your doctor. Be proactive about monitoring your symptoms so that you can better manage your lupus and also avoid any kidney failure and or dialysis. So, so just remember, we are the most important part of the lupus management team. So the more symptoms you share with your doctor, they can sort through them and make note and make sure that nothing really is going on too bad with your lupus. I think it's really important that we share those symptoms and just get in the habit. It may feel a little strange at first, you know, coming in and really taking over those appointments and sharing your symptoms and asking questions. But again, remember that appointment is about you and taking care of you. Has anyone kept a lupus journal up until now? Maybe you are, and if you are, maybe you can share some of your best practices, because again, we're learning from each other, and you may have a great way that we haven't thought of. So go ahead and put that in the chat box if you like, because I think it's a great way for us to help each other and make sure we're tracking our symptoms and writing our questions down. So make sure you're getting the right nutrition, and know that some foods may affect your lupus. So keep track of meals and snacks in a health journal or in your journal that we talked about. Talk to your doctor about any foods that you may limit taking or eating, any foods that you may avoid, or are there any foods that you may include? And so if you feel like your doctor isn't giving you enough information, they have tons of resources and they can refer you on to someone who can help you, like a nutritionist or a dietitian. So, so if you're concerned about what you're eating and what you need to avoid or limit, and best things that you may want to incorporate into your diet, talk to your physician about that as well, and they can help you with that. Your doctor may give you nutritional guidance to aid in your kidney health. So also, if your kidneys are impacted, you want to make sure you're on a low sodium diet. So you may want to cut back on salt to help lower your blood pressure and how much fluid your body retains. A low protein diet may help with taking the burden off of your kidneys a little bit. And also renal diet. So limit intakes on sodium, phosphorus, and proteins. So these are great questions to talk to your doctor about and find out what would be the best nutrition and diet for you if your kidneys are already impacted, or also just as a lupus patient. So have those conversations with them so they can help you with that as well. Another lupus warrior wrote, keep a log of your symptoms. Watch what you eat and drink. When there's a symptom, be sure to log what you've eaten so you can track those flares. So that's a really important point. So if you happen to notice that you're having a flare, try to think back to, was it your diet? Was it something that maybe you ate? Think back to, is there a lot of stress going on in my life? Think back, was I in the sun a lot? Whatever may have triggered that flare, just try to take a moment, self-reflect, and think back, what could it have been that might have contributed to that flare? And that information helps your doctor and also helps you so that you can limit exposure to whatever it may have been. Also remember to take some time for you. Think about, how is lupus impacting your daily life? How is lupus impacting the lives of your loved ones? What areas of your body are you most concerned about? Do you have any concerns about organ complications? So use these as great questions to, you can talk to your doctor about this. So just take some time, again, the night before your doctor's appointment, just kind of reflect, think about these questions here or some other questions that you may come up with, and just put it in your journal so that you can talk to your doctor and have a conversation about what's most concerning to you. Communicate openly with your healthcare team. If you're concerned about lupus affecting your kidneys, ask your doctors some questions about your kidneys. Ask them what those lab reports mean. Ask them, can you make any changes in your diet to help your kidney function? And what steps can you do to continue to monitor your kidney function? We spoke a lot about signs and symptoms that you can be on alert for. But yeah, I really encourage you to continue to have these conversations about your kidneys, about, if you have issues with your heart or lungs, or any of your rashes, whatever is impacting you with your lupus, make sure you have those conversations. But I would always ask questions about my kidneys anyway, because they're doing all these lab tests on us anyway. If we don't understand the lab test, ask them for a printout of your lab results, and ask them, could they please go over that with you? Because sometimes there's information on there that we might not understand, and we want to make sure that we get those questions answered by our doctors. Stay up to date on all your tests. Your healthcare team may recommend routine tests throughout your life when you have lupus. To understand how lupus is affecting your kidneys, your doctor may do a urine test. We spoke a lot about that. They're checking for, blood in your urine, protein in your urine. They may draw blood to check your kidney function. And also they're looking at your other organs too. They can tell. They're doing a whole complete analysis of your blood. And within that analysis, it tells you how your kidneys are functioning, how everything else in your body is functioning as well. So you want to make sure that you're getting those lab tests done. If you do a kidney biopsy, they're checking for any scarring and any inflammation that's going on in your kidneys. They want to see how severe the kidney damage may be. So that's why they would want to do a kidney biopsy if they ever, ask you to undergo a kidney biopsy. That's what they're looking for. They want to see how severe has your kidneys been damaged, and what lupus is doing to your kidneys. So again, these are great things to ask your doctor to explain the results to you on if they are doing these tests. Connect with the specialist. So if your rheumatologist refers you on to a specialist, make sure you connect with them, and you're open, you're honest, you bring your symptoms, you bring your questions to the doctor. They may refer you to a dermatologist for your skin, a cardiologist for your heart, a nephrologist for your kidneys, a rheumatologist. We all know who our rheumatologist is, but they help us with our lupus and our bones and our joints. And so also make sure you just make a really good connection with whatever specialist they send you to. Get the right treatment. So your treatment plan is personalized to you. So you and your doctor should decide on a treatment that works best for you and your lifestyle. And so again, if something's not working for you, talk to your doctor about that and find a treatment plan that does work for you. These are classes of medications that they may prescribe. They're the most common classes of medication. So they may prescribe anti-inflammatories, corticosteroids, immunomodulators, immunosuppressants, antimalarials, ACE inhibitors, beta blockers, and diuretics. And there's lots of different medications within each of these categories. And so sometimes patients are prescribed more than one of these categories. And so again, lupus is very personalized, right? It's a fingerprint disease. So all of our lupus impacts us differently. Therefore, our medication and treatment plans may be different than others. So this is why it's really important that you talk to your doctor so they can personalize a treatment plan for you that works for you. Continue to stay informed about lupus. You can continue to research symptoms and treatment options and potential complications like lupus nephritis or other complications related to lupus. You can look at lupus.org, rheumatology.org, kidney.org, and you can also go to usandlupus.com, and you can also go to LFA's website, Adrian's website, which is the Lone Star chapter, as well as Lupus Foundation of America National. And that will give you a lot of great information that you can research about your lupus. So these are QR codes, and if you scan them, they will take you directly to the topics that we spoke about. And so if you want, go ahead and take your camera out and put it up to one of these barcodes, QR codes. And what you'll see is when you scan it with your camera, you'll get this little link that pops up, and you click on it and it takes you right to the area of the website that's at the top of the QR code. So for example, I scanned identify common lupus symptoms, and then that's what came up. I don't know if you can see it very well, but it came up, and it's just a quick way to get to the common symptoms of lupus. You can also scan and go to register for a symptom tracking kit, and this tracking kit has tools and checklists in there for you, and what they'll do is they'll email it directly to your email. So you just have to fill out a little form. It just asks for your email address, have you been diagnosed with lupus, and those types of questions. And these tools will come directly to your email box, and then you can download them from there, and you can just print them off how often you like, and you can utilize these tools before you go to your doctor's office to really help you have that conversation with your doctor about any of your concerns since the last time you saw your doctor, any of your symptoms, any of your questions. And then also, of course, you can go and scan and look for more information on lupus nephritis. And then also, you can also scan the basics of lupus. So, and if if you're getting tired of scanning, you can just go to usandlupus.com. You'll see at the bottom of the page, that's where our website is. So I really encourage you to bookmark that website so that you can use it as a reference. You can send family members, caregivers, loved ones, friends to this website so they too can start learning more about lupus. Because it probably gets a little bit exhausting sometimes when we're trying to explain and educate everybody who's part of our life. And this is a great way that you can help educate them. And let's see what else. And that's all that I have for today. So I really thank you and appreciate your time this Saturday. I hope there was a lot of good nuggets in here for you and that you find these resources helpful. And I'm going to turn it back to Adrian if she wants to see if there's questions.
Yes, thank you, Angelia. If you have any questions, you can either unmute yourself and ask, just chime in anytime, or you can drop it in the chat box. Is there a way on Us and Lupus site that can help me manage my lupus?
Yeah, there's tools. There's tools on there, and there's education. And I really encourage everyone to utilize those tools. They're easy to get. You just, again, you fill out that form. You go to usandlupus.com. You fill out the form, and you get these tools emailed directly to you. And there's checklist, there's impact tracker. Those are two of my favorite. There's other tools on there, but I love those two tools because it really can help you organize, you know, what symptoms are bothering you, how lupus is impacting you, and then you can use that when you go into the doctor's office to talk about what's been going on with you in between your appointments.
Should I ask my doctor to check for signs of kidney issues if they're not already doing so?
Yeah, I don't want to say I'm 100% positive, but in my opinion, your doctors are probably checking, but I think that's a great question to ask. Ask them, what is the results of my urine test? What are the results of my blood test? Are any of my organs being impacted? How are my kidneys doing? Can you tell me a little bit more about what's going on with my kidneys? Those are great questions to ask, and you deserve those answers because it's about you, your lupus, and you're trying to learn more. And the more you know and understand what they're checking on each time you go into your doctor's office, the more you can help them each time you show up into those appointments. So yes, absolutely. Ask your doctor about it.
Okay. And then why is lupus nephritis more common in African Americans, Hispanic, Asians, and men?
Yeah, remember earlier in the slide, we're not quite sure of a lot of things about lupus, but we do know that it impacts people of color. It's, hormones, genetics, sometimes it's the environment. They're not quite sure, but they know all of that plays a role in lupus. And then also, unfortunately, some populations have it more severe than others. So just continue to just be open and honest with your doctor, track those symptoms, share those symptoms, because that's the best way that you can help take care of you.
Okay. And then do you know how long a kidney biopsy will take, and is it painful?
I think that's a great question for your doctor. I'm not quite sure how long it takes. And I don't want to give you any wrong information or misguide you because I am not a kidney doctor, but talk to your rheumatologist about that. And also, ask them, should you see a nephrologist? So that's a good question. So put that down in your journal to ask that question when you go to your doctor.
That's a perfect answer. Yes, always ask your doctor those questions. If you have any concerns, talk with them. Is there anyone else on here that wants to ask a question? Can you unmute yourself? All right. Ooh, that went away. Well, if not, thank you so much, Angelia, for speaking. And thank you to our sponsors, GSK and Us on Lupus. Please go visit their sites. There are tips and tools on there that you can use. If you have any questions, you can always email us at info@lupuslomestar.org. Thank you again, Angelia, and thank you, GSK and Us on Lupus. Y'all have a great weekend.
Thank you, everyone. Bye-bye.
Bye-bye.
See you next time.